In 2024, one cyber attack exposed medical records of 190 million Americans, more than half the US population. One breach, one company, one catastrophic security failure.
Welcome to the final episode of our AI in Healthcare series. I'm Sam Day with Mac, tackling the question, keeping healthcare executives awake. How do we harness AI's power while protecting the most sensitive data we have?
Let's start with our episode, Healthcare Data Security in the AI Era. 38% of healthcare organizations use AI regularly, but 72% of executives list data privacy as the top AI adoption risk. So, what is the scale of the problem here? The numbers are shocking. AI privacy and security incidents rose 56.4% in 2024. Nearly half of breaches involve customer personally identifiable information, exactly what healthcare AI needs to function. So let's dive deeper here.
Yeah, definitely. Thanks, Mac.
Yeah.
Someone like me who has been working in the
Yes.
healthcare industry for a long time, I can resonate, my experience resonated with that. Like you mentioned, personally identifiable information, which
Right.
also mentioned as PII. And we also have PHI, which is called as personal health information. So this issue has been pretty predominantly impacting the healthcare industry at this moment, especially in the emergence of AI. Because at the end of the day, AI will definitely synthesize data, process data, but how do we make sure that we are putting guardrails so AI are not manipulating the data, especially, in people's records here. It's a data, if you see, you cannot unsee. We have seen that healthcare breaches average 11.0, and big pharmas are spending a lot of money in terms of addressing some lawsuits there. And that basically considered it as the most expensive sector for 14 consecutive years. And those costs sometime increased 1.3% from 2023, despite growing security spending. This is a massive lot of money we're talking about. And the main reason because the data. At the end of the day, healthcare evolves around human, and we deal with human and patient records. So how do we make sure that AI can, be utilized in such a way that it won't impact the security of the data and people's data will be safeguarded? And that's the problem we are going to talk about in this episode. So Mac, back to you. What do you think about what are the other scalabilities of these problems that looming largely in the healthcare sector?
So one of the things that I definitely want to talk about, Sam, in this regard is about the crisis sparking and congressional action as well. So we definitely need to talk about the vulnerabilities as well, right? I mean,
Yeah.
AI fundamentally changes the threat model. AI systems process far more data than the traditional systems, right? I mean, if you think of that way, like we have used data warehouse, but how much data that we can even process in just in fraction of minutes, right? I mean, even you can see the volumes like on daily basis or on a weekly basis or on the monthly basis. Even though if we can process some of them, still so much manual effort is needed, and for different teams needs to be involved. But now AI systems are, way more faster when it comes to processing the data. Electronic health records, medical imaging, lab results, genomic data, clinical encounter recordings, much larger attack surface, right? And AI is handling efficiently. Also, then there is shadow AI, right? Employ using unsanctioned tools. A 2025 survey showed that 86% of healthcare IT executives reported shadow IT instances, right? I mean, and that is even up from 81% in 2024. So 26% admit sensitive data reached public AI platforms. So Sam, what is your thought on this?
Yeah, I mean, this shadow AI, it's a kind of a real challenge in the healthcare sector because you cannot just use any tools, especially when you're dealing with the healthcare data, people's health records, physician records, and all kind of
Right.
stuff. It's a real data, and nobody wants their data to be compromised, right? Like we have seen a scenario like, a doctor paste patient info into
Right.
ChatGPT to save time. But they have spent, I mean, that means they're sending those protected health information outside secure environments. So it's kind of like, I would say sometimes it's an education gap. We also need to make sure that whoever handling the data, they're going through proper training program to understand the severity of these data breaches. Right now, unfortunately, only 17% of organization have technical controls blocking this. So the educational awareness is the best way to do at this moment to make people aware of the ramification of all these data breaches.
Absolutely, Sam. And I want to also add one more point, memorization, right? I mean, AI models unintentionally retain and reproduce sensitive details from training data, right? As you mentioned.
Mhm.
And once incorporated, that removing them, it's extremely difficult. And raising data deletion rights get questioned. Now, let's talk about more on emerging threats. So
Mhm.
we talk about like how we are using, in healthcare, what are the attacks. Now let's talk about the real threats. You can actually identify individuals like without traditional PII. So
Correct.
leakage attacks identify or attributes by cross-referencing online repositories. Researchers have identified individual medical records and demographics even in the compliant datasets. So Sam, what do you think that if someone belongs to a disease related or vulnerable groups without PII, I mean, what can change the trajectory? Like, what will be the high risk? What can potentially do with the high risk patients without accessing the medical records?
Yeah, I mean, these are the threads that we can talk about that for hours because there are so many different aspects of it. Like there is this area like a membership inference determines if someone belongs to disease-related or vulnerable groups without PII, and you can use that to cross-reference that person's social data or anything, and you can still find out PI because at the end of the day internet is so fast that you have all the data somewhere in the online system residing, right? And building AI agents and stuff will give you easier access to those data. Like, for example, like AI based biometrics infer identity from de identified sources,
Mhm.
like
Mm.
ECG
Right,
patterns, gait analysis, writing style in clinical notes. All this information somehow stored in an online
right.
platforms, right? And most of the cases this bypass traditional privacy protection because regulators did not anticipate them, right? So they don't even know that data resided somewhere. If they don't know that where the data reside, how do they put compliance guidelines on that? So this is a real issue. The 2025 International AI Safety Report highlights AI models trained on PII without individual knowledge or consent. Even a 2025 survey showed only 21% of Canadian physicians confident about AI and patient confidentiality. So this is a huge threat in the sense that people not only aware of the AI toolkit that they are using, but they are not even aware of that how they're, I mean, inadvertently exposing the healthcare and patient records to an online systems. And it's kind of like a walk in the park for any hackers to kind of manipulate those data, causing data breaches.
Yeah, absolutely, Sam. And you have raised some valid points, extremely valuable. For example, like ECG pattern, gait analysis, also AI safety reports. I think especially like who are in the healthcare professional, I mean, for them, it's extremely important to be aware of AI safety report as well, because that there are a lot of clinics and a lot of even if for hospitals, doctors, like they are into in AI, but we also need to go about, like, we also need to review about the AI safety, that whenever we are handling at massive level AI, when we are dealing with the healthcare records, and sometimes we also need to make sure that all the AI models are actually trained on PII, right? I mean, so that's actually one of the most important points here. So now let's talk about the solution part of it, right? I mean,
Mhm.
the privacy preserving technologies are advancing. Federated learning allows AI training across institutions without data leaving those institutions. The model travels to data, learns locally, shares only aggregated insights. The differential of privacy, adds mathematical noise, so individual records can't be reverse engineered. right? While preserving statistical properties that AI needs. So, homomorphic encryption allows computations of encrypted data without even a decrypting. So, Sam, we talked about synthetic data in episode T. So, what do you think? Like, what could be the solution? Is it only that since synthetic data, or can you share your thought on this?
Yeah, you kind of just read my mind because I was going to say that the synthetic data could be another key solution because I think we talked about it in our previous episode that how synthetic data can be used to train AI on, high quality data sets, mimicking real populations without containing actual patient information. I think that could be the most viable option here. And also, the silver lining here is that some of these AI policies are catching up. EU AI Act entered force in 2024, applying obligations through 2026. European Health Data Space, published March 2025, also standardizing data access. And in the United States, HHS proposed the first major HIPAA security rule update in decade. For all listeners, I believe you're aware of HIPAA. It's one of the governing act that
Right.
protect the data, the PII data in the healthcare sector. So I would say that at the end of the day, we have to come up with two solutions. One is utilizing synthetic data to large scale. So that way the AI systems will not be vulnerable to disclose actual patient information. And on the other side, try to come up with more stringent policies. And that's where US government and any other countries, governing bodies need to play a role to impose some strict compliance practices, so especially to organizations who are dealing with healthcare data. I think these are the two solutions that I would like to share with our listeners that they should think about in terms of imposing and keeping their data secure from any AI malpractices.
Yeah, that's great, Sam. And before moving to our next sections, that I would definitely remind our listeners that please subscribe to our newsletter on Substacks. Please subscribe to our podcast and also subscribe to our YouTube channel, Assemble AI, and give us some feedback and rate us. And also, please let us know if you want to hear any specific topic, either in healthcare or any of the other sectors, especially in AI related. Now, Sam, you brought some valuable points as well. Let's talk about our next sections, that what would be the path forward, right? I mean, AI in healthcare.
Sure.
So,
Hmm.
because we didn't see that it's not even slowing anywhere, right? I mean, it's just rapidly growing. And even if you compare like where AI has been started in 2024, and as per our data that what we got for 2024, and now the spending hit 1.4 billion in 2025, right? I mean, it's nearly triple that what we have seen in 2024. FDA approved almost 1200 plus AI powered medical devices, right? And this technology is here to stay, by the way, because it's a massive improvement. In healthcare sector is actually leveraging AI on full swing. Now, the question is not whether to use AI, it's how to use it responsibly. 68% of physicians recognize AI's benefit, right? But 84% demand stronger data privacy assurances, right? So, Sam, where is the gap? Starting from 80 68%. I mean, the data just I explained. What do you think that where is the gap exactly?
Yeah, I mean, that's a really great question. And I think that's the best way to kind of wrap up the session because at the end of the day, technology is not going anywhere.
Mhm.
We will see more AI adoption in the healthcare sector, but we still need to close the gap between technological innovation and the
Right.
responsible AI. So closing that gap requires technical solution, better encryption of your data, federated learning, utilization of synthetic data, and cultural change because at the end of the day cultural change requires because you need to make people aware that healthcare data PI, those are like some people's medical records. Nobody wants their data to be compromised, so we need to keep that in mind. Training data on a synthetic data platform is crucial because 83% of physicians highlight comprehensive training is important. At the end of the day, you need to make your AI learn, right? And training is the
Right.
only way to do. So that's why we need to keep a balance between AI governance and the data security. I know that for a fact that 47% called for increased governance, ensuring compliance. AI needs specialized oversight beyond general IT governance, so on and so forth. But the AI governance, coupled with responsible AI practices, are the only way to close the gap and making sure that we are actually, moving forward with the AI adoption in the healthcare sector without compromising any massive data breaches in the future.
Absolutely, Sam. And it completely resonates that, what we're looking for. So as we know that AI can revolutionize healthcare, improving diagnosis, personalizing treatments, accelerating discovery, reducing burnout. But none of it matters if we can't protect a patient privacy and maintain trust. And the challenge here is to scaling these practices across the entire industry, especially to smaller organizations. That's where the policy and regulation establish the baseline standards protecting everyone. So it's time to wrap up today's sessions. If you find out that it's valuable, please share it with your network. And once again, subscribe to our channels. Thanks for joining our AI and healthcare journey from drug discovery to patient care, AlphaFold to data security. The future is arriving faster than expected. Thank you.
And make sure to share this series with others navigating this AI in healthcare question. Until next time on Assemble AI, keep questioning, keep learning, keep pushing for technology serving humanity in responsible way. Thank you.